my name's Kenzie. I'm going to be the student with your provider today. I'm going to be doing your health history and physical exam. So first I'm just going to wash my hands, and then can I get your last name and date of birth?
Harrison, 11/30/97.
Perfect. And then how old are you?
25.
And then what is your race?
What?
Okay, sounds good. So I'm just going to sit down and we're just going to go through some health history and get a little bit of information as to what brings you in today. So is there anything that's going on that brought you in today?
I've had a headache for a couple days.
Okay, and then when would you say it started roughly?
On Sunday.
On Sunday. For palliative and provocative, anything that helps make it better or worse? Tylenol helps it better, but nothing really makes it worse, so to speak. Okay. As far as quality, what would you say the headache is like? Is it dull, achy, or?
Yeah, it's achy.
Achy? Sounds good. And then does it radiate anywhere, like to your eyes, sinuses, back of the neck?
No.
No? Okay. And then severity, what would you rate it on a scale of 1 to 10?
Probably a 3.
A 3? Okay, not too bad. And the Tylenol you said helps it. And then as far as time, is this a new thing for you, or do you have like chronic headaches usually? Chronic. Okay, sounds good. So we're just going to go into some of your past medical history. I'm just going to ask you a couple of questions. So starting with, how would you say your general overall health is?
Pretty good.
Good? Okay, good. Do you have any chronic illnesses?
No.
And if so, I would ask if she did have chronic illnesses, how she was treating them, how they're being managed, and if she felt like they were being managed well. Moving on, do you have any infectious diseases that you're aware of? No? Okay, perfect. Do you have any allergies to like foods, medications, anything environmental? Penicillin, okay. And then any recent surgeries? No. And so no complications with anesthesia that you're aware of?
No.
Perfect. Okay. Any recent injuries or hospitalizations?
No.
Awesome, that's good. Do you believe that you're up to date on immunizations?
Mm-hmm.
Perfect, good deal. And then when was your last physical exam?
About a year ago.
And then do you feel comfortable talking about your sexual history today? No? Okay, that's okay. Okay, if she were comfortable with talking about her sexual history, I would ask her about how many partners she's had, if there's any concerns for STIs or she's had testing done in the past, what type of protection she uses, and that's pretty much it. Okay, we're going to move on to family history. I'm just going to ask you some questions about immediate family to the best of your knowledge. As far as your paternal grandparents, how old is your grandfather?
He's deceased.
Deceased. Any health history that you know of?
Some general heart disease.
Heart disease. And then what about your paternal grandmother?
She's deceased and
no issues. Okay. And then what about your maternal grandfather?
we didn't have contact with him.
Okay. What about your maternal grandmother?
She's a history of brain tumors.
Brain tumors. Sounds good. And then as far as with your parents, how old's your mom?
She's about 52.
And then any health history?
She has some autoimmune.
Okay. And then what about with your dad?
He's deceased.
Deceased. Any health history for him?
Heart disease.
Heart disease. Okay. And then do you have any siblings?
Yep.
And then how many?
2, an older sister and a younger brother.
Perfect. Do they have any health history that you're aware of? No. Perfect. Okay. Any biological children? No. Okay. Sounds good. I am just going to review with those people who we just discussed. Is there any issues other than what you had already mentioned, cardiovascular wise? No. And then what about neurologically? Anything with their lungs? Anything with their gastrointestinal system? Anything with the endocrine? Any history of osteoporosis? Any bleeding disorders? Any cancer in the family other than brain tumors? No. Any mental health history?
Some depression.
Depression, okay. And then any seizure disorders? And then lastly, any substance abuse? No. Okay, sounds good. Moving on to social history, these are going to be a little bit more personal for you, so just part of the assessment. Just starting off nice and easy, where were you born? Janesville, very nice. And then what is your ethnicity and nationality?
Hispanic.
Okay. And then are you married?
No.
Are you in a relationship?
Yes.
Perfect. And then what do you do for work?
I'm a nurse.
Very nice. Do you feel you're okay or any concerns financially? Perfect. And then what's your living arrangement?
I own a house with my fiance.
Okay, very nice. Do you consume caffeine?
Couple times a week.
A couple times a week, nothing too crazy. And then what's your diet like?
It's okay.
It's okay. Would you say you're adequately hydrated?
Yeah.
Yeah, okay, sounds good. Do you exercise?
Yes.
Perfect. Do you have any like leisurely activities or hobbies that you enjoy?
Not really.
Not really. Okay, no worries. Any tobacco use? Any substance use?
No.
And then any alcohol consumption?
Sparingly.
Sparingly. Okay, sounds good. How much sleep do you think you get?
Probably 7 hours.
About 7 hours? Okay, that's not too bad. Do you have any alternative healthcare remedies that I should be aware of as of right now? No. Perfect. And then with living in the house with your fiance, any violence or safety concerns that you have?
No.
Perfect. Now we're just going to go over a review of the systems going between each body system, getting an overall picture as to how your health looks. So we did discuss already constitutional. You said that your health generally is pretty well off, right? Perfect. Okay, moving on to your eyes. Any changes in vision? Any drainage or abnormalities that you can note? When was your last eye exam?
About a month ago.
About a month ago. Perfect. And then moving on to your head, ears, nose, and throat. Any issues with the head? Any lumps, bumps, concerns? No. For the ears, any ear pain, discharge, drainage, irritation? No. For the nose, any drainage or difficulty with smell? And then for the mouth, have you noticed any lesions or abnormalities? Any difficulty with chewing and swallowing food? Perfect. Okay. Moving on to your cardiovascular. Have you been experiencing any chest pain, shortness of breath, irregular heartbeat, palpitations? No? Good. Going into your respiratory system, any difficulty breathing?
No.
Okay. And then do you feel like you have a cough at all?
No.
Awesome. Okay. Heading into your gastrointestinal, do you feel like you have pretty regular bowel movements?
Mm-hmm.
How often would you say?
Every other day.
Okay. And they're normal consistency, soft brown, no issues with diarrhea or constipation?
No.
Any abdominal pain or discomfort?
No.
Perfect. For your GU system, would you say you have any difficulty with urination, any pain or burning with urination?
No.
Any discharge that you've noticed? Okay. And then going to musculoskeletal, any joint pain?
No.
Any like abnormalities or deformities that you've seen? And then any issues with your range of motion for any joint? No? Okay, perfect. For your skin, breasts, as far as you're aware of, there's no skin lesions that there are to be concerned of anywhere. And then for your breasts, any concerns about any changes in the skin there? And then do you perform monthly breast exams?
I do.
Perfect. If she did not perform monthly breast exams, I would educate her on the importance of doing so. I would recommend her once a month to stand in front of the mirror with her arm at a 90-degree angle and palpating from the top and going around in a circular motion looking for any nodules, lumps, discomfort, and any drainage from the nipples. And then moving on, we'll talk about psychiatric. Any issues with depression, anxiety, or sleep? No. Neurologically, do you have any dizziness, numbness or tingling anywhere? Changes in coordination or balance?
No.
Perfect. For your endocrine, do you feel like you have difficulty regulating your body temperature? You get too hot or too cold?
No.
Any weight changes?
No.
Any changes in your hair that you noticed, getting brittle or falling out or anything?
No.
Perfect. For heme and lymph, do you bruise easily?
No.
And then do you feel like you're sick often?
No.
Okay, good. So moving on, we're going to move into the physical exam. We're just going to start with the overall appearance. The patient is alert-oriented. She has well-mannered affect, no signs of distress, unlabored breathing, and appropriate for the situation. All right. Can I have your height and weight?
About 5'6" and 160.
Okay. And then I would obtain vitals. I would utilize the blood pressure cuff to get her blood pressure, checking for her heart rate, her pulse ox, and then a temperature as well. Okay. So first I'm just going to come over and I'm going to inspect your head, just palpating to see if there's any discomfort, Skin looks good, no lesions or abnormalities noted. Hair is appropriate and diffuse. Head is atraumatic. There's normal texture of the skin and hair, and there are no lesions. I'm going to palpate the temporal arteries. Arteries are palpable. Your frontal and maxillary sinuses. So just let me know if there's any pain, okay? And I'm just going to move your glasses for a moment. Any pain?
No.
Okay, good. I'm going to go back to you. Make sure I don't make them fall on your head. Skin is dry. There are no rashes, lesions, or atypical moles or anything that I can see. If there were something, I would perform an assessment using the ABCDE method, and then using terms such as macule, papule, abscess if needed. I'm going to assess cranial nerve number 5, the trigeminal, so can you smile? Perfect. And then, or actually that was cranial number 7, my apologies. Cranial number 5, I'm just going to grab a Q-tip and we're going to test for sensory function. So close your eyes and then let me know when you can feel something. And then it's normal all around?
Yep.
Perfect. Now I'm going to inspect your eyes. Conjunctiva looks good. There's no scleral redness or erythema, no drainage noted. Eyes appear to be well. I am going to grab my pen light and we're going to assess for Perla. So I'm going to have you stare straight ahead at me, and I'm just going to bring this light over into your eyes, okay? Good, and Perla is present. Pupils are equal, rounded, and reactive to the light. Next, I'm going to use my ophthalmoscope, and I'm going to check for the cornea and in the iris to see if there's any issues there. So I'm going to be able to come in at a 45-degree angle. And then again, just stare straight forward for me. It's coming in at a 45-degree angle. I can see the back of the cornea, looking for the nerve. Everything looks good. And looks good. Oops. Next, I'm going to be testing for cranial nerves 3 ocular motor, 4 trochlear, 6 abducens by doing the 6 cardinal signs. So I'm going to have you follow this pen light looking straight at me, and then we're going to go into 6 directions. So starting here, and we're going to go up, to the side, down. Good. Cranial nerves are intact. And then moving on, we are going to go to the ears. So I'm going to perform the whisper test to check for cranial nerve number 8, vestibular cochlear. Okay, so I'm just going to come around behind you and then just repeat the word that I say to you, okay? I'm just going to plug this here. Perfect. So that cranial nerve is intact. Moving on, I am going to do the Weber test with the tuning fork. So what I'm going to do is I'm going to place the tuning fork above your head after hitting it, and I want you to let me know when you stop hearing it, okay? Okay. And it's equal on both sides?
Yep.
Perfect. So with the tuning fork, I'm now going to perform the Renee test. So what I'm going to do is I'm going to place it at the back of your ear, and then tell me when you don't hear it anymore, and then I'm going to bring it to the front, and then tell me when you don't hear it anymore. Okay? So starting with the right. Okay. And then the left. Okay, air conduction is 2 to 1 times of bone conduction, which is within defined limits. Next, I'm going to grab my otoscope and we're going to take a peek at your inner ear. So, oops, my little piece just fell off. Okay. Visualizing in the ear, I can see the tympanic membrane, which is pearly gray. I can visualize the incus and malleus, and the cone of light is noted. There's no drainage or irregularity or erythema. And again, on this side, same case. I can see the tympanic membrane. It's pearly gray. I can visualize the incus and malleus. There's no erythema or drainage present, and the cone of light is there. Okay, moving on to your nose, I'm just going to take a look at it. It's symmetrical. I don't see any redness or irritation. No drainage is present. I am just going to take a peek at it with my otoscope again. All right, I'm just going to have you tilt your head up, and I'm going to look in, and everything looks symmetrical. No erythema, no drainage present. There's no obstructions. The nasal mucosa is within defined limits, and the turbinates are pink with no drainage noted. I'm going to test the olfactory nerve, which is nerve number 1, cranial nerve number 1. Just let me know if you can smell this alcohol pad. Good. Thank you. All right. Moving on, I'm going to test cranial nerve number 9, the glossopharyngeal, and number 10, vagus. I'm going to have you say ah, and then can you swallow? Perfect. Then number 12, the hypoglossal cranial nerve. Can you stick out your tongue? Awesome. Thank you. Cranial nerve 12 is intact. I am going to take a peek at the inner part of your mouth with my otoscope as well. Okay. Look up at me and say ah. Looking, your soft and hard palates are intact. Pink mucosa without, no lesions noted. Tongue has no lesions as well either. It is symmetrical. The anterior and posterior pillars are pink and without edema, and the tonsils are present with grade +1. Okay, moving on to your lymph nodes. I am going to palpate your lymph nodes kind of in the front of the body first. So I'm going to be first going into the preocular and the posterior ocular, the occipital, tonsillar, submandibular, submental, and then coming down into the anterior cervical, and then the posterior cervical. And lymph nodes are good within defined limits. Next, I'm going to look at your trachea. It looks to be symmetrical. There is no deviation. I am just going to check for your thyroid function. So I'm going to place my hands here, have you tilt your head up just a little bit, and then swallow. Good. Alrighty, moving on, I'm going to test cranial nerve number 11, the accessory nerve. So I'm going to place my arms here, and I want you to push up. Good. And then I'm going to have you lay back onto the pillow a little bit, and I'm just going to check for JVD, so jugular vein distension. Can you just turn your head slightly to the left? Okay, good, and then slightly to the right. No JVD noted. Perfect. And then you can go ahead and sit back up. So next we're going to move on to your thorax, lungs, and cardiovascular assessment. So first we're going to start with noting that your respirations are 16. They are normal, they are not labored, and they are equal bilaterally. I am going to have you swing your legs across and sit with your feet down. Yep. So I'm just going to be checking AP diameter. And ratio is 2-to-1, which is within defined limits. We did talk about breast exam already. And then we're going to go into posterior thorax percussion. So I'm just going to come behind you and I'm just going to tap a little bit, just listening to your lungs. Good. And when I'm back here, I'm actually going to just palpate your spine. Let me know if there's any discomfort. No bulging or abnormalities noted. Any discomfort anywhere?
No.
Good. Okay. Moving on, I am going to listen to the back of your lungs first, making sure to listen to 8 spots minimally. So every time I place my stethoscope on your back, just take a deep breath, okay? Good, and lung sounds are clear. No diminishing or crackles or wheezes noted. Moving on, I am going to palpate your ribs and your sternum just for any abnormalities. Any tenderness anywhere? No, perfect. Okay, so now I'm gonna just measure chest expansion. So I'm gonna put my arms here and I just want you to take an inhale and exhale. Chest expansion is equal, which is normal findings. Moving on, we are going to listen to the front of your lungs. Again, listening for at least 8 spots. Same thing as at the posterior. I want you to take a deep breath every time my stethoscope moves, okay? Good. Again, lung sounds are clear on auscultation. Moving on, I'm going to have you lay flat onto the couch or the bed, so to speak. And I am just going to be looking for any heaves or lips noted for the cardiovascular system. No heaves or lips are noted. So next what I'm going to do is I'm just going to palpate your apical pulse. Apical. And pulse is palpable and normal, no irregularity noted. Next, I am going to assess your carotid arteries, making sure to only assess one at a time. So I'm going to do it both by palpation and by auscultation. So I'm going to start with the left. And the right. And then I'm going to take a listen. Good, no brewing noted. Next I'm going to listen to your heart sounds. So I'm actually going to have you sit up about a 30-degree angle if you can. I know it's tricky. And we're going to use the mnemonic. I totally spaced on it. APETM, utilizing the bell first on my stethoscope. So I have your apical, pulmonic, Erb's point, tricuspid, and mitral. And then I'm going to listen with the diaphragm side of the stethoscope as well. Apical, pulmonic, Erb's point, tricuspid, and mitral. No clicks or murmurs noted. Heart rate is regular. S1 and S2 are noted as well. So moving on, while you're lying flat, I am going to assess your abdomen for any bulging or brewing or anything like that. So as of right now, stomach is flat, no bulges or anything noted. Skin is within defined limits, no lesions, abnormalities, rashes noted at this time. I am going to just inspect that there are no pulsations. And then I'm going to listen to the abdomen, listening in all 4 quadrants. Abdomen has normal active sounds, no concerns. Next, I'm going to assess for bruits, abdominal, and then also checking the abdominal, renal, iliac, and femoral arteries. So, starting with the aortic. No brewing is noted. And then the renal. None on the left. No brewing on the right. Iliac. No brewing noted on the left. No brewing on the right. And then femoral. No brewing noted on the left. And no brewing noted on the right. Next, I'm going to percuss your abdomen. And I'm going to percuss your liver, okay? And liver is about 6 centimeters in diameter, which is a normal finding. And then I'm going to palpate or percuss on the spleen. No abnormalities noted. Moving on, I am going to palpate first as a little bit of a light pressure in each quadrant. Let me know if there's any discomfort, and then I'm going to go in and do it a little bit more pressure, okay? Alright, a little more pressure. Any discomfort anywhere? Good. No masses or lumps noted. Next, I'm going to I'm going to palpate for your lymph nodes in this general area, starting with your pectoral. So I'll actually have you sit back up. So assessing pectoral lymph nodes. And then your lateral. And then subscapular, and your infraclavicular, and then the supraclavicular. And lymph nodes feel normal. Good. So I'm gonna actually have you lay back down. Sorry about that. And I'm gonna assess your liver more. So what I'm gonna have you do is I'm gonna have you take a deep breath. Can you actually lay all the way flat? Thank you. I'm gonna have you take a deep breath, and I'm going to put some pressure on your liver. So you'll take a deep breath in and then exhale. And as you exhale, I'm gonna push down. Okay. So when you're ready, go ahead and inhale and exhale. Soft, smooth, with no hepatomegaly, noted. Good. And then I'm going to palpate the spleen again, which also there are no masses, noted. And then I'm going to be assessing the kidneys utilizing the duck-bill method. So what I'm going to do is I'm going to kind of use my hands like this, and I'm going to pull. So you might feel a little discomfort, but there shouldn't be too much. So I'm just going to go like this. Good. And then on the other side. Kidneys are not palpable, which is a normal assessment. Moving on, I am going to check for any cardiovascular tenderness. So I'll have you sit back up with your feet to the front. And I'm just gonna, I'm gonna hit here, and I just want you to let me know if you feel any tenderness, okay? Good, perfect. At this time, I would, if my patient were a male, I would talk to him about the importance about testicular exam, letting him know that he should be performing them once a month, looking for any abnormalities such as masses, nodules, discharge, or anything else, and if there were concerns, to bring it up to his healthcare provider. All right, so moving on, we're going to be testing your, we're going to go into your upper and lower extremity assessment, starting with the upper extremities. So what I'm going to have you do is first I'm going to assess the skin of your shoulders, elbows, wrists, and fingers to the best of my ability. Like you had noted before, there are no lesions or concerns. Just going to look. Skin is dry. No erythema, cyanosis, or other pigmentation noted, no pallor. Next, I'm going to palpate your joints. Let me know if there's any pain, okay? So palpating the shoulders, anything, elbows, wrist, and the fingers. Good. Okay, moving on, I'm going to be testing some range of motion. So I want you to follow what I do. So we're going to first start with the shoulders. So I want you to do flexion. So I'm going to have you raise your arms up. And then extension, push them back. Good. And then we're going to do abduction. And then adduction. Any issues with that? Good. Now we're going to do your elbows. So I'm going to have you start with your arms kind of out like this. And I'm going to have you do flexion, extension, pronation, and supination. Any issues with that? Perfect. Moving on, I'm going to have you do your wrists. So again, we're going to do flexion, extension, and then we're going to do radial deviation and ulnar deviation. Good. And then we're going to do fingers as well. So I'm going to have you flex your fingers out like this, and then crunch them into a fist. And then you can relax your fingers, and I want you to do abduction and adduction. Perfect. Any issues with any of that range of motion? Awesome. Things look good. So now I'm going to test the strength of each of those muscle groups. So we're going to start with your shoulders. I want you to push up on my hands, and then I'm going to have you pull back, and then push forward. Good. And then same with your elbows. I want you to push out, and then I want you to resist me when I push, so pull in type thing. Good. And then with your wrists, again, I'm going to push down on your hands to resist, and then I'm going to push up. And then I want you to grab both my hands and squeeze nice and tight. Good. Looks good. Moving on, we are going to do the Fallon sign, which is going to have you go like this. So I'm going to have you kind of go into a reverse prayer, and we're going to hold it for 60 seconds, and then I want you to just kind of push a little bit. And then any numbness or tingling noted with that, any discomfort. Okay, good. And then you can relax. And then we're also going to be doing the tunnel sign. So I want you to let me know if there's any numbness or tingling in your wrists while I tap on them, okay? Anything? Okay. Next, we're going to test your deep tendon reflexes. So I'm going to grab my reflex hammer. And we're going to start first with your biceps. So I want you just to relax your arm. Good. And then I'm going to do your triceps. So I'm just going to hold your arm. I want you to go nice and limp. Good. The other side. Good. And then next we're going to test your brachial radialis. Okay, good. And then moving on, we're going to do a sensory test. So I'm going to utilize the back of this as sharp and then the front of the hammer as dull. So just so you know, this is what sharp feels like. And this is dull. So I want you to close your eyes and then we're going to just do a little bit of a sensory test, okay? So let me know if it's sharp or dull.
Sharp.
Okay.
Dull. Dull. Sharp.
Perfect. Looks good. Next, I'm just going to palpate your pulses. So I'm going to start with your radials. And then ulnar. And then I'm also going to palpate your brachial. Good. Pulses are +2. And I'm just testing your cap refill. Cap refill is less than 2 seconds, which is a normal finding. Okay, moving on. Now we're going to do your lower extremities. So what I'm going to have you do is I'm going to have you actually stand up and we're going to test your range of motion for your hips. So I want you to, again, kind of like we did previously, follow what I do, okay? So starting with your hips, I'm going to have you do flexion. So I'm going to have you bring your leg out and then kick back for extension. Good, and then do it with the other leg. So flexion and extension. Good, and then you can stand straight. And then we're going to do abduction, so moving your leg out, and then adduction. Good, and then the other side, abduction and adduction. Good, and then I'm going to have you do, with the right leg, we'll do internal rotation and external rotation. And then you can do the same thing with the left, internal rotation and external rotation. Good. And then we're going to do the knees. So I'm going to have you, you can actually sit back down unless you want to test your balance. So what I'm going to have you do is I'm going to have you kick your leg out and then you can bring it, so that's flexion and then, or sorry, that's extension and then flexion is back down. Good. And then do it with the other leg. Good. And then we're going to go to your ankles. So what I'm going to have you do is I'm going to have you put your feet up like toes to the ceiling for flexion, and then for extension, point your toes. Good. And then I want you to rotate internally and then rotate externally. Good. And then for your toes, can't really see it with the socks, but what I'll have you do is kind of similar with the hands. I want you to fan your toes out and then crunch them into a ball and then go out with the toes for abduction and then bring them together for adduction. Good. Any issues with any of that range of motion? Awesome. So now I'm just going to test your strength of the muscles. So I'm going to test your hips first. What I'm going to do is I'm going to push in and I want you to resist my hands. Okay, ready? Push. Good. And then I'm going to pull out and I want you to resist. Good. And then I'm going to, for your knees, we're going to have you push up against me and then pull back. Good, and then push up against me, and then pull back. And then for your ankles, I'm gonna push down. I want you to try to pull your toes up. And then I'm gonna push up, push down. Good, strength is equal bilaterally. So next what I'm going to do is test your deep tendon reflexes for those as well. So we're gonna do both your popliteal and your Achilles. If you can try to scoot your butt back just a little bit to dangle. Okay. So try to nice and relaxed. Good. 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 Alrighty. And then just like for the upper extremities, I'm also going to palpate your pulses on the lower extremities. So I'm going to start with your femoral. And then popliteal. And then your posterior tibial. And then the dorsalis pedis. And pulses are +2 and equal bilaterally. Okay, so next what I'm going to do is I want to test your gait and your balance. So I'm going to have you stand up again, and I just want you to take a couple steps forwards towards me with your arms at your side. Any issues with balance or anything like that? Okay, then you can go ahead and go back. So what I'm going to have you do is we're going to do the Romberg test. So I want you to close your eyes and then just stand still, okay? Patient is standing upright. There is no swaying noted. Perfect. And then we're also going to do the pronator drift test. So what I'm going to have you do is I'm going to have you put your arms out like this and close your eyes. And then just hold them there, okay? Perfect. No drifting is noted. All right, and then the last part of the exam is going to be a spinal exam. So what we're going to do is we're going to do some range of motion with the spine first. So what we're going to do is first for the cervical spine, I want you to put your head up and then down and then tilt it to the left and the right and then make a circle one way and then the other way. Any issues with range of motion there? Okay, and then we're going to do the thoracic spine. So I want you to put your hands on your hips, and I'm going to have you push out, and then cave in, and then kind of go to the left, and the right, and then back to center. Any issues with range of motion there? Good, and then we're going to do the lumbar spine. So I'm going to have you bend forward, and then extend back, and then kind of when you're standing like this, we're going to go side to side. I want you to try to reach to the floor, and then to the floor, and then just rotate. Any issues with range of motion there? Okay, so next I'm going to have you take a couple steps forward, and I'm going to actually have you face the wall. And what we're going to do is we're going to, I'm going to palpate the spine again while you're standing. Again, let me know if there's any discomfort. No deformities noted. Everything looks as expected. So what I'm going to have you do is we're going to check for scoliosis. So I'm going to have you bend and touch your toes, and then I'm going to have you stand back up. So go ahead and bend down. Good, and then go ahead and stand back up. Good, and then there are no concerns for scoliosis. Okay, and then you can go ahead and have a seat. So I know that was a lot to go through, but that concludes our physical assessment and health history exam. Did you have any questions or concerns for today?
No.
Well, thank you for your time. I do appreciate it. And if you have any questions, feel free to reach out. Thank you.